Hey guys, it's Dr. Childs here, and today I want to talk to you about Synthroid overdose, and specifically I want to talk about the signs you are taking too much thyroid medication. So why does this matter? Well, it matters because Synthroid is one of, if not the most commonly prescribed medications in the United States. And some version of this medication is prescribed in other countries as well in a very high amount. And so when you have millions and millions and millions of people taking a specific medication, there's going to be a lot of people who are taking either too much or not enough, in which case they might be overdose or underdose. Now, and even if that's a small percentage of millions of people is a lot of people. And so we're going to be focusing today on those signs that you might be taking too much, but just realize that a large portion of you might also be underdosed as well. So let's talk about the common symptoms, then we'll talk about the more rare but serious side effects, and then we'll go into some other useful information I think for you as well. So what are those common symptoms? I have them all listed right here. And so basically I would say, well, let's just go over them and we'll talk about them, how common they are. So one of the most common I would say is increased hair loss. Now this can get confusing because hypothyroidism can also cause hair loss. Taking too much thyroid medication can cause hair loss, but also taking Synthroid by itself, one of the side effects of Synthroid is hair loss. So this can be confusing because there's at least 3 different reasons for you to have hair loss if you have thyroid disease, but taking too much can cause this, so we are including it here. Another one is weight loss. Now this does occur, but not always. In fact, it's common for some people to take too much medication and gain weight as well, so don't just assume that that's the only thing that can happen, although some people do lose weight. Another common one is the sensation of having tremors in your extremities, so that's like shaking of your extremities, they're trembling, that kind of symptom. That one is fairly common, I would say. A lot of people do have it, along with the next one, which is a jittery sensation. So just feeling a little anxious or feeling like you're really amped up. That I would say is probably one of, if not the most common side effects of taking too much medication, thyroid medication or Synthroid. Another one is heart palpitations. So this just feels like your heart is beating out of your chest, and it's mostly scary to people that experience it, but it's generally not harmful. Just the sensation of having the palpitations is usually just a feeling. It's not like your heart is actually being damaged. That can happen, but it's very, very rare. So most of the time, heart palpitations, they just feel terrible, but they're not actually serious. Another one is anxiety. Kind of goes along with the jittery sensation or the tremors, but patients do experience that. Now, those who tend to experience anxiety or panic attacks are those who are prone to having anxiety already. And so it's not like everyone who takes it will experience it, but if you already have a history of it, taking it, on top of that is likely to, or may increase the rate at which that occurs inside of you. Another one is flushing of the skin, which kind of goes along with heat intolerance, and these are also very, very common if you take too much compared to some of the other symptoms here. So that's just feeling like your skin is hot to the touch. In fact, it may be warm to the touch when you touch it. And then heat intolerance. So if a heater is blowing on you, or hot, if you walk out into hot air or something like that, if it just feels really, really uncomfortable, that's a sign you might be taking too much. Now those are the common side effects. So all of these, some more common than others, but those will tend to happen. Now there are some other rare but very serious side effects as well. Now some of these are associated with taking way too much, and some of them are associated with taking too much Synthroid over a long period of time, but I do want to include them here just for completeness sake. One is osteoporosis, or decreased bone density. And so if you take too much Synthroid, it amps up the turnover of bones in your body, because your bones are constantly being strengthened and broken down. This whole process is occurring constantly all the time. But if you rev it up too much, then you might turn over more than you're building, which hollows them. It doesn't really hollow them out, but you can kind of think of it in that way, and makes them less dense and increases the risk of fracture. Another one is heart enlargement. So thyroid hormone is stimulating to your heart, which can cause it to grow. And if it grows, you might develop something called atrial fibrillation, which is a rhythm disorder of the heart. And so it causes the heart to beat funny, which can increase your risk of stroke. Another one is chest pain. It's very rare. It does happen, but usually only happens in somebody who already probably has some arteries that are clogged or stenosed, and then you put extra demand on the heart by taking thyroid hormone, and that could trigger the chest pain. It may be related to the heart itself, or it could be related to your lungs and the fact that it's beating too hard. You really need to go in and have that kind of assessed to figure out which it is, if it's heart or lungs or a combination of the both. But that's the other one, shortness of breath. If you experience any of these, especially chest pain or shortness of breath, though, that would be considered an emergency. Okay, and so the other ones, not so much, because you can just eliminate your dose and they'll go away. Like especially a little bit of jittery sensation, that's not that big of a deal. But having chest pain, that is a big deal. Now, when you take too much thyroid medication, the symptoms will be there, but also you'll have changes in your lab tests. And so I've included some of the basic changes that you might see here with your thyroid labs if you're taking too much Synthroid. And the first is a suppressed TSH. And I say this should be differentiated from a low TSH. So a low TSH is not necessarily a problem. But if you suppress, meaning you drop your TSH into oblivion or to the point where it's less than 0.01 or 0.001, that means that it's just not really detectable, which means it's almost zero for all intents and purposes here. But a low TSH, just having it flagged as a little bit low, that's not necessarily a problem. But getting rid of it down to zero, that is a problem if it stays there for a long period of time. So you might see a suppressed TSH. You might also see a low TSH, depending on how sensitive you are. But the suppressed TSH is more concerning than the low. You might also see a high free T4 if it's checked. So the free T4, Synthroid is made of T4, and so if you take a lot of it, then you might see a high free T4. You may or may not see a high free T3. That really only occurs if the T4 that you're consuming, which is your Synthroid, is being converted by your body to T3. So it's possible you might have a suppressed TSH, a high free T4, and a normal free T3. But some people do experience high, low suppressed TSH, high free T4, high free T3. So that can occur. Now, we talked sort of about what the symptoms are, but what are the long-term dangers of being overdosed for a long period of time? We mentioned them briefly sort of above, but the two most important ones would be the increased risk of developing osteoporosis or the reduction in bone density, and then also the changes to your heart. So some people feel better when their TSH is suppressed, and that does happen occasionally, and I'm not going to be the one to tell you that you are absolutely going to develop osteoporosis or heart problems as a result of that, but you just need to realize that it will increase your risk of that. Again, it doesn't mean that you will for sure experience those side effects, but it does increase your risk. The exact percentage that it increases your risk is not well known, but it could be plausible that it increases it from 1% to 3 or 4%. So, it's not like it's a guaranteed thing that you'll experience these things, but it is absolutely something to consider. But if you had the argument that suppressing your TSH improves your quality of life dramatically, and you can't really function if it's not the case, well then that's sort of a decision that you can make with your doctor if you determine that it's worth it for you. But you should at least be aware of those potential side effects. So what happens if you just temporarily take a high dose of Synthroid? How long is it going to be in your system? So this does happen where somebody they take a bunch on accident, or they forget they took it earlier in the day and they take it again. Is that going to be a problem? And the answer is almost always no. It's just not a big deal. So Synthroid will be metabolized out of your body usually within the matter of a month. So it has what's called a half-life of about 5 to 7 days. And a half-life means that over a certain period of time, in this case 5 days or 5 to 7, half of the dose that you take will be eliminated. So let's say you took 100 micrograms of T4, which is a fairly normal dose. After 5 to 7 days, that 100 will no longer be 100 in your body, it will be 50. And so then in another 5 days, it will go down another 50%, or it'll be cut in half. So it'll go from 100 to 50 to 25 to 12.5, etc. Now, it takes about 5 half-lives for it to be completely eliminated from your body. So if we just looked at it that way, we would do 5 times 5, which is 25, or 5 times 7, which is 35. So somewhere between 25 and 35 days, that dose is going to be completely eliminated from your body. But usually, even if let's say you double or triple your dose, probably within about 7 to 10 days, it will be back to a normal range that you're used to dealing with. So just a temporary taking a high dose of Synthroid, usually not really a big deal, unless you took 10 or 15 or 20 times your normal dose, which is unlikely. I don't see that happen. It has happened in some. I've seen case reports of some children consuming a large amount, but they're usually fine within a matter of days, like we're talking about here, just because their body gets rid of it naturally and uses it naturally on its own. So that's pretty much it, guys. Hopefully you found this helpful. Remember, these are the warning signs, and if you feel like you're having signs that you're taking too much, it's really easy to figure it out because all you need to do is go get your labs tested and then adjust your dose. So in the event that you have some of the more serious or rare but serious side effects, then that means you need to do something a little more, see your doctor, or go to the emergency department, depending on what the symptoms you're experiencing. But hopefully this was helpful. If you have any questions, leave them below and I'll do my best to answer them. And otherwise, I'll see you guys in the next one.